We'll start looking at nephrectomy, and fortunately, this will be our first video as regards nephrectomy. And here we're trying to look at the introduction to the whole concept of nephrotic syndrome. Okay, sorry, it's nephrotic syndrome I've been wanting to talk about. Okay, so nephrotic syndrome does have to do with somebody is urinating and they are urinating with a lot of proteins in urine. So normally it's not supposed to be there like that. Proteins are supposed to be held back in the body because they are useful. Okay. But the person is urinating with a lot of proteins in urine. That's nephrotic syndrome. So it's just a kidney disorder and it's defined by heavy protein loss, you know. So um, that means what? If you are losing proteins, which is primarily what albumin, you'll be having low levels of albumin in blood. That's what hypoalbuminemia, So there'll be swellings too. Okay. Swellings in your body because there's retention of, you know, fluid, so to say. So definition is a clinical condition that is characterized by what the person is passing out a lot of proteins in urine, about 3.5 grams per 24 hours, you know, and the amount of albumin in the body is reduced because what is rather lost, you know. So edema, there's swellings in the face, there's swellings in the legs, swellings in the abdomen. You can see that. So also hyperlipidemia. So there's accumulation of bad cholesterols, you know. So okay, so that means what? The glomerular basement of the kidney is what increased because normally protein should not be able to pass through it. So if it is what if protein is passing through it, that will tell you that the permeability is increased, you know. So causes it could be due to kidney disease, loudest minimal change disease, focal segmental glomerulosclerosis, membranous nephropathy. Okay. It could be secondary things like diabetes mellitus, which is causing diabetic nephropathy, systemic lupus erythematosus, amyloidosis, and also what? Different infections could have an effect on the kidney, thereby causing some damage. You know. So clinical features is what? Edema. So there's facial swelling, okay, mostly in children, but in adults there's actually leg swellings. And if they urinate, you see that the urine is foamy, okay? Weight gain, fatigue, and poor appetite. They don't want to eat very well. So complication, there's increased risk of infection because you are losing immunoglobulins, which will strengthen your immune system. Then progressive kidney damage and also thrombosis. So diagnoses include urine tests like proteinuria tests, all those dipstick, okay, blood tests like all those for albumin, cholesterol, and general kidney function, where they also try to test that for um, creatinine levels and also glomerular filtration rate levels. So they also image the kidney so that they can actually look at the anatomy. Okay, physically, what are the things that have gone wrong with the kidney? Okay, so management include you have to reduce the amount of salt you are taking. They can give you diuretics, you know, they give you drugs that will help to put out the fluid, and also statins to reduce the amount of lipids in the body, like corticosteroids, immunosuppressant, okay, like cyclophosphamide, cyclosporines, rituximab. That's probably if the issue is related to your immune system, or if they come and do a kidney transplant for you and they need these drugs to suppress your immune system so that your immune system can be able to access or accept the kidney that was transplanted to you.